As global partners in care celebrates 25 years, it is a major achievement. It's not only just a quarter of a century, but years of engagement with partners and APCA members and stakeholders. And we are happy and very delighted to celebrate with you.
I'm honored to congratulate the African Palliative Care Association on 2 decades of dedication and impact. Over the past 20 years, APCA has been a champion for evidence-based palliative care, and the team has persistently advocated to reduce pain and suffering across Africa, and in doing so, have impacted countless lives across the continent. At GPIC, we've long championed partnerships, and it became very clear early on that APCA was a key partner. Through the years, we know their journey hasn't always been easy, but they've persevered and continue to reaffirm that palliative care is not just an option, but an essential component of healthcare throughout one's life.
And looking back now, looking where you are, I'm just amazed how this has grown and has continued to inspire hospice and palliative care movement across Africa. And I think we should all be thankful for those people who had the foresight to start such a partnership.
APCA and GPIC come together, I think, to provide resources, education, knowledge sharing between countries, between different organizations, all with the goal to improve access to palliative care. And I think it's a great example of how cross-country learning and partnerships can improve not only the organizations themselves, but the people they impact and palliative care as a whole globally.
Our relationship with APCA is so important to ensure that our work on the continent is collaborative, contextually and culturally appropriate, informed by the best evidence and expertise available, and linked to larger advocacy and service development efforts in palliative care.
But for GPIC and APCA, all I hope for is that you can continue to build leaders who can continue to drive this work. You can continue to secure resources, because I think the expertise is there.
I'm deeply grateful for both the personal and professional relationships over the past 20 years. We appreciate and respect all of the work accomplished by Dr. Emmanuel and the entire team at APCA to support capacity development in palliative care at all levels. We thank you for all you've done, and we are eager to see all you will accomplish in the many years ahead. Congratulations on 20 years of impact.
As we move into the future, especially as we focus on universal health coverage 2030 and working on the contents of the resolution that was passed in 2014, this partnership is very important because it helps us to focus on key aims of those 2 frameworks, making sure that we have qualified personnel to move the agenda forward, but also that they are able to strengthen the partnerships between our organization, and that we are able to continuously engage with stakeholders to push the agenda for palliative care within the continent. And we hope for more partnerships and linkages between hospices and providers in Africa and those in the United States.